Dr. Tsoh.
Thank you so much, Dr. Das and Dr. Ward and NIMHD for this opportunity to share with you all about our work on hepatitis B and C screening with Asian American at this webinar today. So today we'll share with you the study that focusing on a randomized trial to test an interactive video patient education program called Health Within Reach to increase hepatitis B and C screening among our Asian American patient population in primary care. So I have no disclosures. All right, let's start with some background. And Asian Americans currently constitute 7% of the US population, and the fastest growing racial group in the United States. 2 in 3 Asian Americans are immigrants, and many of whom, more than 40% of the immigrants, do not speak English very well with limited English proficiency. As you have heard from Dr. Paris-Stavely mentioning about Asian Americans also as a group having the highest chronic hepatitis B viral infection rates, more than 10 times the rate among non-Hispanic whites, for example, from the data in 2019. And certainly screening among HBV, HCV remains suboptimal. Depending on the studies, oftentimes we see like more than 50% of the population have never been screened. What do we know right now? What are some of the interventions that have shown working in terms of, with the Asian American populations? Here are some examples. First of all, kind of looking at education, working directly with Asian American populations. You can see these number of studies here. A lot of them using a community health workers approach, lay health workers approach. Some of them involve home visits. Some of them actually involve church settings, and more intensively involving packaging in like a patient navigation. Some more study here focusing on provider levels, electronic health record-based strategies, alerts to the provider, including our own, just recently published in the Journal of General Internal Medicine, where we involve both patients and provider, and we'll tell you more about it. This table just show really general, like a quick summary, a quick look at just examples of some of these interventions that have been tested, and many of which are relying on self-report, some of those with confirmation from electronic health records as well, or medical health records. And you can see the odds ratio illustrating the intervention effects. They work. They actually did quite well comparatively. And you can see there are various intensity level as well. When it comes to electronic health record-based strategies, also we are seeing very positive outcome, particularly with EHR alerts running in between like 2 to 3 times in terms of the odds from as compared to usual care. And the last line about our intervention also will tell you more details, kind of when we work with both patient education and providers together, we're seeing quite positive outcome there. All right, let's dive into allowing me to tell you more about our intervention, Health Within Reach. It's a multilingual video doctor. We use a lot of focus group talking points, heavy involvement with our stakeholders, both providers and our patient community to develop this application. Available in different languages: English, Cantonese, Chinese, Mandarin Chinese, and Vietnamese. The idea here is to leverage clinical visits, where while the patient is waiting to see their primary care provider, they will get to receive this interactive video doctor intervention. The design of our study to test the efficacy of this intervention is to compare the intervention package, which include the video doctor, which I will tell you a little bit more about, integrated with a provider alert piece, and plus provider panel notification. Actually, this also serves as a control or usual care, or more like enhanced usual care intervention. And we tested it in 2 healthcare settings. A little bit more details: the video doctor, what does it have? It started off with some assessment questions. And then in these assessment questions, we also provided tailored video messages Some of those contents involve, releases basic education of why is it relevant? What is hepatitis B and C? Why is it relevant to Asian Americans? What does it do? And some of the misconceptualization, perhaps also stigma some people may have. One of the topic that we heard from both our provider side and also a lot of it from our stakeholders, both families and patients, talking about, I'm not necessarily feeling comfortable to ask for the text, to ask for screening. My doctor should know it, So there are also potentially some communication barriers as well. We mentioned about the provider alert, which is at the end of the session. We have the 2 printouts, one for the patient to keep, the other one is for the actual patients to bring it to the doctor for discussion. More of the video clips or the demo of the program, you can see it in the PCORI site, and I believe that will be shown on the chat as well as a link that you can go in to take a look. A little bit more details of the provider alert, where example, this is like in multilingual in the language of choice of the patient, and certainly for the providers we have in English. And you can see for the patients section is really talking about recommendations or reminders of what they have just seen, some of the key messages. And on the provider side, at the bottom of the alert is really serve as a cue for action, like reminders of the screening. And particularly because we're enrolling only those who had no EHR, no documentation on their medical record about having been screened for hepatitis B. For the control condition, we do attention control, while all the providers receiving their panel notification. For those who randomly assigned to the control group, they also receive video education. Is another app, and is focusing on nutrition, physical activity, and healthy weight. About our study design, a cluster randomized trial. Randomization took place at the provider level, and patient eligibility, Asian Americans, as actually shown on medical records, but we further asked them, do they identify themselves as Asian Americans, age 18, speaking one of the languages, as I mentioned earlier, English, Cantonese, Mandarin, or Vietnamese, and also have no hepatitis B screening on medical record, and have an upcoming PCP visit. Recruitment, we use multi-pronged approach from telephone all the way to in-person right before the person comes to the visit. Multiple data sources, some patient directly survey data right before the intervention, immediately after the visit with the doctor, and also 3 months later. Primary outcomes looking at screening rates, also tests being ordered from electronic health records 3 months after the intervention. This is just to summarize. Altogether, we have 452 patients in this trial, and they from altogether 122 primary care providers, and 270 in the intervention group, and 182 patients in the comparison groups. Here are the patient characteristics, pretty diverse sample. Average age is about 57, wide age range 18 to 93. A lot of them were born outside of the United States, actually from more than 20 countries of origin, and 44% spoke limited English. Before we get into the screening results, I'd like to share with you, did patients like it? Did they like it? 84% said that they liked the hepatitis app very much, to somewhat. Almost 60% of them gave the printout to the providers at the visit. 95% found the printout was helpful for discussing with the provider. I'd like to share with you a couple of pictures. One of the barriers actually before we launched a study, we also talked with our staff, our clinical staff and providers about potential barriers, many of whom would think that, nah, for our older patient, we didn't think it worked. This is actually a picture of an 80-some-year-old patient participant. He had no trouble using the app at all. Here's another picture just to show how much our patient liked it. As an example, this patient actually, while he was going through the app, he was using his phone, taking screenshots of the app and saying that, I want to tell my families and friends about this information. Some results from EHR in terms of orders and receipts of screening, starting off with hepatitis B. You can see the blue bars, they are from the intervention group, those who received the hepatitis B and C video doctor education, plus provider alert on the site. And then the green bars are the comparison group, receiving the video doctor education on other topics, nutrition, healthy weight, and physical activity. So you can see the rates in terms of tests ordered within 3 months, 44% had the test order, and close to 38% of those have the test completed within 3 months of the intervention, as compared to less than 10% for the control group. For hepatitis C, we also see very encouraging results as well. Almost 40% of them had the test order. Certainly not everybody are appropriate as well, because our eligibility criteria were focusing on a no Hep B screening on medical records. And then 30% of the population had hepatitis C screening done within that 3 months, as compared to under 10% again of the control group. Intervention effects, looking at multivariable models where there are a lot of patient characteristics being controlled. For hepatitis B, with receiving an odds ratio 7.5 times higher the odds as compared to the control group of having the screening test done within 3 months. Even a bit higher of the intervention effects for hepatitis C as well, having tests done 10.5 times higher the odds among those who are eligible for hepatitis C test within 3 months of the intervention. What have we learned? Conclusion: this multilingual mobile application for patient education not only well received by our patients of Asian American descent who spoke those languages that we mentioned, English, Chinese, and Vietnamese, but also it led to increased hepatitis B and C screening. So I listed some references here for the PCORI final research report, as well as the recent publication on hepatitis B outcome, but we are hoping that our hepatitis C paper will be also coming out very soon as well. Leaving you with a few thoughts on recommendations about working with Asian Americans or addressing hepatitis-related health disparities, focusing on screening, leveraging clinical visits with technology, particularly technology designed through a patient-centered approach that can be easily used by minority patients and even among older and those who speak limited English, can greatly increase screening, hepatitis B and C screening among Asian Americans. When it comes to targeted interventions, well, keep in mind, Asian Americans is a very diverse population, not only language, culture, there are also evolving needs. So always keep that in mind. Multi-pronged approach or multi-pronged approaches that involve multi-players, stakeholders. Remember, I shared with you about both patients, providers, very important, takes a village to do this in a coordinated, integrated way. Last but not least, I want to acknowledge my team and a number of individuals, both our advisors, our patients, our providers who have contributed so much in this work. And thank you very much.